Hi, John here with Total Health. I'm joined by one of my two favorite pharmacists of all time. Can you guess who the other one is?
I'm hoping it's Ross Pelton, but maybe it's Earl Mendel.
No.
Who is it?
Susie Cohen.
Oh, Susie Cohen. Okay. All right, I know Susie.
Shout out to Susie.
There you go. Hey, Susie, how you doing?
Because pharmacists to me, I think are really, really important. Especially pharmacists like you that have written over 18 books. But I think pharmacists, they're on the front line. And pharmacists do a lot of research that I think a lot of doctors don't do.
Well, obviously I'm a pharmacist, so I really value pharmacy as a profession, but I think the interesting thing I don't think people realize is pharmacists have to learn everything about every specialty because, we have to dispense all the drugs, and you have to know how they all work, and that's how actually the transition from a drug to being interested in natural compounds is very easy for a pharmacist because as long as we understand the mechanism, it can make sense to us to make a recommendation if you come up to us and we're talking to you. Now I'm more in clinical practice as a clinical pharmacist, so I get to sit down with patients, and I've done that for about 30 years now. But it's really, I think it's a fascinating profession, and I think, people trust pharmacists the most of any healthcare professional. So, I kind of dig that too.
Well, that's true. I like that. Right now, there's books been written about it. Like one of the biggest killers of Americans is properly prescribed medication.
Yeah, well, it is kind of a negative dark side, right? And I would have to say that, part of that problem is people are already sick when they get medicines prescribed to them.
Right.
Their metabolism is disrupted. They aren't eating right. They're not sleeping. They're not exercising. They got a lot of things they're doing wrong to begin with. Then you expect that drug to fix all that. And I think if we looked at a more responsible way of saying, when people, like I've seen this in our clinics, and when I teach physicians, we discuss this. When you get people's chemistry straightened out, they don't need as many drugs. So they use more natural products, they eat more organic foods, they exercise, they sleep better. Okay, that's a great start point. But when you do need to give a drug, a lot of times the adverse event potential kind of starts to go down because the person's not as sick, So I'm kind of on the fence. I'm a big believer that we should try to manage everything on the natural side of the fence,
Yes.
But I do realize that there's times when medication is needed. It's going to have to be used. But boy, it would be great if people had a little bit healthier chemistry when they decide to take that drug because boy, they do have side effects.
Well, that's one of the things I really like about your book, Your Blood Never Lies. So we better get the book up there.
Wow, there we go.
James LaValle, Your Blood Never Lies. What book number is this again? This is 18,
it's, I
19?
can't even count anymore. It's a 19 maybe. I'm kind of scared. I just my chapter of the book in a preventative cardiology textbook just came out. So I wrote a chapter for a couple of cardiologists were the lead editors, but I wrote the chapter on drugs, to your point, drug-induced nutrient depletions in drugs that are used for cardiovascular disease, because a lot of times the drugs that they use end up depleting nutrients that your heart needs.
Right.
So it's CoQ10, vitamin D, selenium, magnesium is a biggie, and then of course if you're taking blood pressure meds that drop zinc out and your testosterone goes low, now all of a sudden that increases cardiometabolic risk as well. So I'm always active writing and trying to communicate with people.
Right. Well, that's one thing I noticed right away about your book. Then we're going to talk about diabetes because diabetes is a huge problem in this country. But what you talk about in Your Blood Never Lies, I read a lot about like Mercola and other people. They're talking about, get your blood tested, get your vitamin D level tested. And,
right.
The people say that. But what was great for me, even knowing what I know from all my research, what a great book.
Oh, thank you.
All the tests are there.
Yes.
But you explain the tests.
Right.
And you don't just talk about nutrient depletion and whatnot. When you talk about the drugs that are necessary, you explain what the side effects are.
That's right.
So you put everything into perspective. But what I like is the whole approach of self-managed healthcare, because that's really what Total Health Magazine is. We stand for self-managed healthcare, educating our readers, our viewers, our listeners, giving them the tools to ask the right questions of their health practitioner.
I think that was one of the big, obviously the big impetus for me to write this book was, people would come into our institute in Ohio and now my center in California, and they would say, I would say, well, you get blood tests from your doc, and they said, well, they're all normal. So, well, what does normal mean? Are they high normal, low normal? Right. Who is normal anyway, right? But the point being is that if you don't know what those labs mean, how do you know that you need to take action? And it's really important. What I found over all the years of working with people now, 32 years in clinical practice, and really probably one of the biggest clinics in the country when I was back in Ohio, the more I could explain what was going on for people, the more I could empower them, so that you don't need to motivate somebody once they understand what the problem is. They'll start to work and make the changes. That was the impetus behind the book. Understand your numbers. I always tell the story, if you're one step away from the Grand Canyon, that's a lot different, meaning the edge of the Grand Canyon.
Yes.
That's a lot different than being 20 steps away. So when your blood values are one step away from falling off the chart, that's a lot more call to action that you may need to start paying attention than, say, maybe if your numbers were ideal.
Right. So that's, again, the book is great for that because it gives you the tools to understand your blood tests, what blood tests you should be taking. And I like, you really have really good all-around advice because you do, I want to see people running out and trying to take their own blood.
Right.
That was one of the things I was like,
don't do that.
Go to a proper.
Don't go do that.
Where's that vein?
Exactly. Oh, that wasn't a vein. Whoops.
And I like the tip, bring a heating pad or something when you're waiting in the waiting room to have your blood test drawn to make that vein pop out a little more.
Absolutely. Make sure you're well hydrated. Make sure you know how long you're supposed to fast. Don't drink alcohol. Don't have big, rich meals the night before your lab test because it all shows up in your blood.
Yes.
Your blood never does lie. It's really interesting, and I think it's important that people should get the guidance on lifestyle too, and that's why we added it in there. What kind of diet should you have? What type of exercise should you have? What drugs, what nutrients, but most importantly, once I get my blood test, and I have to tell you, you mentioned diabetes. Blood sugar to me is amazing because we have all these self-test glucometers that you can do. I can stick your finger right now and I can find out your blood sugar.
Right.
But even when I go and I lecture physicians, and I lecture a lot of physicians as a chair at A4M and Metabolic Medicine Institute, I teach a lot of docs. A lot of times, even docs don't know their own blood sugars. And it's one of the easiest things, and really the biggest healthcare crisis we have right now facing us in North America. Canada, just like the U.S., is the diabetes epidemic.
Yes.
So
and diabetes is preventable in most cases, is it not?
Yeah, what I used to talk to people about is, hey, it's a lifestyle disease, right? We used to say, it's all about diet and exercise. Well, it turns out stress has an impact. Low thyroid function has an impact. Do you have enough chromium, magnesium, and zinc and other nutrients in your body? Big studies showing that if your magnesium pool is low in your body, you are at much higher risk of developing metabolic syndrome and type 2 diabetes. So we know there's these other categories of problems that you have to check the box. Infection, it could be genetics, right? And any environmental pollutants play a big role as well, but it still comes down to, I got to tell you, one of the big things, people still eat too many carbohydrates. I mean, it's easy to say don't eat the candy bars and don't drink the big gulp drinks, but the reality is when you see a serving of rice, most people, when they sit down, they eat 10 servings of rice. They don't eat one serving of rice. And I got to tell you, there's no shortage of cupcake stores, right? We know we're not supposed to be eating these foods.
You are.
That's right, bad. No, I mean, look, it's not a problem as much as I think if you understand why you keep eating those things, it helps out.
Oh, I had an epiphany. Actually, I had a personal intervention.
Yeah,
I had a personal intervention. One night, I was away from my family. I was working away, long hours. Right. And one night I was going to watch a football game. So I got hungry. And there's really nothing in my cupboard, in my fridge. There probably was, but I was feeling lazy. I was having some kind of a sugar carb addiction thing going on there. So I go to the store to grab something quick to eat, going in thinking I was going to get like organic breast of chicken or something.
Oh, right.
I leave with like $20 for the junk food, and half of that was chocolate.
Exactly.
Chocolate bars. And about halftime, I realized I'd eaten everything. And I thought, what on earth have I just done to myself?
Right. And you knew better.
And I knew better.
Right.
But I was addicted, and I had to say it to myself. John, you're addicted to chocolate.
And you know what? That brings up that big point. When you get under stress, you go for reward behaviors, right? I need something, chocolate. Some people, it's alcohol. I need carbohydrates. I always make the joke with people when I'm lecturing. Yeah, it feels like you're taking that 5th cookie. You say I'm only going to eat one.
Yes.
And you get to the 5th one, and you almost feel like you're taking the cookie and you're rubbing it on your head. It's like, oh God, it feels so much better, right? And it's because you're trying to get your brain chemistry to resolve that feeling of need, the reward and the comfort that you need. And the other side to that, so addiction's a biggie.
Yes.
Because we eat too many carbs and too many of the craving foods, the comfort foods, right? High carb, high sweet, high salt. What's the most exotic one out right now that's becoming popular in the U.S.? Chocolate covered bacon with salt on it, right? It sounds gross, but people are reaching for chocolate covered bacon, right?
Okay, here's one for you. I just got it in Anaheim at the health show. Chocolate covered chia seeds.
Yeah, there we go.
Organic dark chocolate.
Wow.
With organic chia seeds.
I think that is perfectly healthy. That's a great way to pick it, right? That's a good one.
It's actually fantastic. I'm a cyclist.
Right.
And actually I carry a little baggie with me.
Sure.
When I'm doing my 50-mile rides.
There you go.
I'm telling you, when I'm coming back in and I'm at like mile 45 and I've got to have something, I have those chocolate covered chia seeds.
I'll tell you what, I drive 50 miles. just kidding.
Well, that's why
great.
That's why I'm in San Diego. It's flat.
Right. Exactly. Right.
Riding in Canada and the Rocky Mountains in Montana and
that's a little
Mexico.
different.
Yeah, I know.
Right.
It's flat here.
Yeah. And the other piece to that is, because you just brought it up, is that your body needs to make energy from food, right? And for diabetes, when people become diabetic, they don't make energy efficiently anymore. They make about 19 times less energy out of their cells than a normal person. And so, of course, they know they're not supposed to eat the cupcake, but literally their body is telling them
to eat.
I gotta have this, man. You gotta give me the extra piece of pizza. I gotta have that extra cupcake. I know I shouldn't drink a soda, but I'm gonna drink it anyway. And so it's understanding that there's countermeasures that you have to take to begin to gain control of that, and understanding stress and sleep and exercise are important. I love using, I use white bean extract on people all the time. So I'll use white bean extract because white bean extract blocks carbohydrate uptake. So when you take in too many carbs, or if you're taking in carbs but you're trying to maintain your weight, it can reduce about 60% of that carbohydrate burden on your bloodstream, and it's kind of important because we don't realize this now. The way we mill our carbohydrates, right? All our grains get milled really fine.
Yes.
They all get across the barrier of your intestine and end up affecting our glycemic burden in our bloodstream. And the number one thing that plaques our arteries, because we're all worried about heart disease, right? Number one killer, first sign of heart attack 50% of the time is death, right? So, it's not like you have a lot of warning. No. But what the point being is that, how our blood sugar spikes directly impacts, more than any other thing, how we're plaquing in our arteries. The second thing that does that is a stress hormone, cortisol. And so why I like using things like white bean extract, or the proprietary one that's been studied, it's called phase 2. So why I like that is I can give that to people. I can blunt their carbohydrate response, still get their nutrients from the food, help them manage that blunted response. And then of course using other things like magnesium is so important. Especially for you as a cyclist.
I've been waiting to ask this question as you mentioned magnesium again, so I'm asking it. What's the best way to take it?
Well,
because I see it in water. I see it. You can buy it by the gallon in water. You can.
Oh, sure. Yeah. Drink electrolyte water for sure if you're exercising. People use topical magnesium, for example. You can rub magnesium into your muscles. What's really popular right now is magnesium oil or magnesium gels. I still like taking oral magnesium. So I love it when, and what I do is I tell people take 10 milligrams per kilogram if you're physically active.
Right.
And I use that for all my athletes when I'm doing any kind of counseling with athletes, and it works very well for them. But what that 10 milligrams per kilogram is elemental magnesium.
Right.
And that's where a lot of people get confused. They pick up a bottle of 500 milligrams of magnesium and they go, 500 milligrams. I weigh 100 kilos like myself. I only need to take 2 of those.
Right.
No, because 80% of that pill isn't elemental magnesium. So you got to get enough of it, which means take a powder, take a pill, rub it on you, do an Epsom salt bath.
Does it help with cramps?
Oh, leg cramps, restless leg syndrome. You know how people complain about their legs are cramping and they're restless and a restless motor syndrome? Magnesium is phenomenal for that. The only other thing that I see happens in restless motor syndrome, and I even talk about it in the book, iron. And if you're exercising a lot, I just did blood tests on a basketball team in Florida, and all 16 players basically had low vitamin D, and many of them had low iron and ferritin. And here you find out, as I start to dig into the literature as to why, right? You do the research, you pull blood on people, and you go, well, why'd that happen? Well, it's because when you exercise more than an hour a day on a regular basis, your iron pool goes down. So you could be a man, and you may be anemic, and you're really not being thought as being anemic if you're an adult male.
Right.
But, people are exercising more nowadays.
Right. Oh, that's an interesting point. Well, I'm going to get lots of magnesium.
All right, there you go.
Some nights after a ride, I'll wake up, I'll literally jump screaming straight up in the air with a leg cramp that's so severe, and I'm crushing my toes against the wall.
I'll tell you what, I promise you that if you take magnesium at 10 milligrams per kilogram, elemental, and over the course of a day, don't do it all at once, because magnesium does have another property. It causes loose stools if you take too much of it.
Right.
So you dose it out over the course of a day. I'm gonna bet, and you can, and I'll stand on this since I'm being recorded, that within 2 weeks you're gonna call me and you're gonna say, you know what, that Derm Magnesium suggestion of yours worked.
We're holding him to that.
I love that.
We're holding him to that.
I love that. I always like that.
I'm picking it up today.
All right.
I'll go to my local store here and I'll find it.
Great.
Getting back to diabetes again, if you've got when you talk about these tests, right? If you're these tests are great if you for self-managed healthcare. Obviously, we were talking about that earlier, and it's great to understand your test and everything. But if you go into full-blown diabetes, it's still important to take this test.
Oh, without a doubt, you need to even track your lab values more, because once you're a person with diabetes, other organs start to get damaged. So you're more prone for kidney disease, you're more prone for heart disease, you're more prone for dementia, you're more prone for blindness, you're more prone for fatty liver. 22% of obese people will have a fatty liver, and fatty liver is going to be a bigger cause of the need for liver transplant in the next decade than hepatitis C. And now that is really preventable. So if we're talking about self-empowerment, you really have to understand, if you don't get your blood sugar under control, and you don't get that kind of the fatty liver under control that's associated with type 2 diabetes and obesity, because let's face it, when people are becoming obese and they're overweight, there's an insulin resistance component to it most of the time. They're on their way to becoming diabetic. If you don't get that under control, it's a problem. And remember, that means more than just, I have to eat better and exercise, because that's a part of it, but it's understanding that, I may need to consider management for stress. If you don't sleep enough, there's a big study that just came out and showed when you don't sleep enough, blood sugars go up. And cause diabetes, cause obesity. The big thing about diabetes people don't realize, when you do your blood test for diabetes, for every point over 84, and 84 is right in the middle, it represents a 6% risk of becoming a person with diabetes in the next decade. That was a Kaiser Permanente study on almost 47,000 lives over a decade, where they tracked everybody that was normal. So if you're a 90, right, you have a 30% risk. And 90, the doctor's patting you on the back. It's not a prevention. They're waiting till you get the disease. And of course, more doctors are interested in prevention, but you have to say, wow, I have a 96 blood glucose.
Right.
That means I have a 66% chance of becoming a diabetic in the next decade. I better get to work on counting my carbs. And if anybody wants it, I'll put it on your magazine. I've got a 2-page how to count your carbs little PDF that I will be glad to share with everyone.
We'll take it.
Oh, great. It's non-branded. It's not about anything other than teaching people, if you're having trouble with your weight, and we teach how many carbs you should take in. Count up your carbs in a day, cut them in half, and watch the weight start to come off.
Well, do that. The 3 things. I used to ride a lot more than I do now.
Right.
And we used to do this ride up in Canada called Ride to Survive. It was a 300-mile ride over 2 mountain ranges in 16 hours.
Wow.
Raised a couple of $1 million. It goes on every year. It's fantastic. It's a fantastic event. In fact, I promote Ride to Survive.
All right.
They take all the money. It goes to no organization. Nobody takes money for salaries. You're not writing a check to somebody who's making $600,000 a year to run a charity.
Right.
The bike club, actually, at the end of the year, they pick charities, they pick research institutions, and they write the checks themselves.
Wow. That's fantastic.
It goes right to what is needed.
That's the right kind of charity.
Yeah. So Ride to Survive. Look it up. Now, when I was training for the first ride, I thought I was in great shape. I had been riding my butt off, and riding. And then I did a test. This was one of the first tests that I did that thought, okay, let's measure my cardiovascular health.
Right.
So I thought I was going to come out with flying colors.
Right.
Turns out I was 6 going on 7 years older than my physical health.
Right.
So I was aging way faster than the average person,
right?
Let alone somebody who's supposed to be exercising and in shape.
Exactly.
So one of the things I did, and it was very simple, I just backed way off on the exercise, the hard riding and stuff, started walking. I dropped bread and started walking.
Yeah.
Lost 20 pounds.
That was very intuitive on your part. I do a lot of work with athletes, and you just have to remember that, athletes that are getting paid for a living to do athletics need to train super hard. If you choose to train super hard, you just have to realize it's hard on your body, and that you're going to release more stress hormones. Stress hormones cause insulin resistance. Insulin resistance causes weight gain. So I regularly deal with athletes who at one point start to gain weight. Their blood sugars are going up. Their stress hormones are high. Their blood pressure goes up. And it's understanding that it's that moderate approach that kind of keeps all your hormones in balance and will allow you to get that successful weight loss that you're looking for. Right. And it's okay to train intensely too. I mean, when there's those times when you want to go do a ride for charity, yeah, train it up a little bit.
Yeah.
But what I always teach people is, well, then there's extra nutrients you should take to protect your body against aging in an accelerated way.
Of course. So my point was just that, for people that are thinking about changing lifestyle and exercise, like food, like breaking those habits.
Right.
Of reaching for the muffin or reaching for the donut or the carb or whatever it is, or the eating too much rice. It's the same as exercise.
That's right.
If it only takes 3 weeks of consistent going at it. So if you could just get off the chair and walk 3 or 4 times a week, get 45 minutes in.
Be so important.
And do it for 3 weeks.
Right.
Then it becomes a lifestyle. And the same thing with food. If you can just find a substitute for those first 3 weeks, it's way easier than quitting smoking, let me tell you. So you can do it. I mean, you can change from diet pop to
mineral water.
Sparkling mineral water.
Right.
It's really easy. Get some
even
lemon.
Flavored ones now.
And
right?
flavored ones, or get some
lemon.
Organic lemon, or always go organic where possible.
Exactly.
And just put a little squeeze in there. It's great.
Yeah, absolutely, and I think you bring up a good point. There's just a lot of evidence publishing that even that 3-day-a-week walk has a tremendous risk reduction, in terms of you getting chronically ill. Because I got to tell you, nobody likes to end up chronically ill.
No.
People, you may talk a good game along the way. It doesn't matter. My grandpa drank cigarettes and smoked whiskey, right? Just the opposite, right? But the reality is, for most people, the more your lifestyle takes on kind of these harder, concepts, the more you're at risk and the more you're going to damage yourself and the more the chronic illnesses set in. And that's when the fun stops. You can't be mobile anymore. And I really like what you said because, I started tracking my steps. And I never used to track my steps because I'm pretty much a fitness, buff since, I was 13 years old, right? But I really wanted to do it. I had a hip injury. I couldn't do any kind of running, and I wasn't strength training with weights. And I thought, what, maybe I'm going to walk. And, they talk about getting those 10,000 steps in a day. That's a lot of walking.
It is.
So what I do want to encourage people is, don't hear the 10,000 steps and get intimidated. If it's 3,000 steps, it's better than 5.
Right.
Get started somewhere and work yourself up. Eventually you'll get to that 45-minute walk where you're getting 6,000 or 7,000 steps in. And it can really make a difference in your life. And when you start to combine that with, hey, you know what, maybe I should sleep a little more. Maybe I should do a little deep breath work and learn how to manage my stress. Maybe take a yoga class, take a Tai Chi class. Start to promote a lifestyle that's active with health and healthful habits. but you're right. It just takes a little bit of time and getting started.
Just little things too, like starting your day, 16-ounce glass of water with some lemon in it.
Oh, so easy, right?
It's so easy.
Right.
You know, I started doing that. It was like quite a while ago, but what a difference.
Yeah.
Because I wasn't drinking enough. I was drinking too much coffee.
Oh, yeah. Easy to do.
Organic coffee, of course.
Right.
But I love my coffee. And
Me too.
Got to have it, but no sugar.
Right.
So,
Right.
And I do put a splash of organic half and half in it. I drink it black every chance I can, but so I started drinking that water, and what a difference. I wasn't drinking enough water throughout the day, and then I found myself, just by doing it that one time in the morning, starting to make that a habit. I started drinking more water throughout the day.
It's so important. And, wouldn't it be great if we were all perfect, right? I mean, that's one of, like, everybody has their areas where they struggle.
Right.
And for me, getting enough water was one of those areas for a long time. And same thing, I started just being more consistent about getting it in first thing in the morning, being mindful I needed to add it in. And you know what? It makes such a difference. You know, it's pretty good about food selection. I've been an organic food eater and kind of plant-based diet with lean protein and good healthy fats and a little bit of gluten-free grains. I've been doing that for 30 years, and I've been consistent about it because I like the way I feel when I do it. But we all have those. I like coffee.
Right.
And so hey, you know what? Coffee's water, right?
Yeah.
It's made out of water.
Lots of water.
Right? It's made out of water. And so, you kind of, you just have to start to make those changes. I think your advice is really good.
All right. Well, I certainly love the advice you have in your book, James.
Oh, great.
Your Blood Never Lies, and you'll read a lot more about it on the site. You're looking at this in May because we've got Jim on the cover of the magazine. So enjoy his book and follow his work, because there's a reason why he trains thousands and thousands of doctors every year.
Thanks for having me, and I really appreciate you taking the time to go over the book. And it's all about that passion of making change so people can live healthier lives. All
right, self-managed health care. Your blood never lies. Get your test done. If you've had your doctors, if you've had your test done by your doctors, get them to send you your test results, and then get the book so you can analyze them.
Absolutely, and don't just look at the highs and lows on that lab test. Make sure you look at each lab and find out, are you at the high end, at the low end? Is it good or bad to be at the high or low end of even the normal range?
Right. Okay, so great advice. And Jim, I actually have something for you here. This is from one of our sponsors. You're going to love this. This is for your bike. Actually, this is for everything in your house. It's a new technology. It's called AIM, Planet Safe Lubricants.
Wow.
That's AIM. Right. It has no smell. You can drink it, but I only suggest you do that if you're constipated, because it reduces friction everywhere.
All right. This is great.
You can use that all over your house, your car, your boat, whatever. It doesn't matter. On your bike, your chains, your bearings, your skateboards, if you're a gun collector, it works great. And
fantastic.
This is the Green WD-40.
Wow.
This product is going to replace every aerosol can product in the market.
This is fantastic.
Yeah. So.
All right. Plant-based too. I love that. Thank you.
You're welcome.
All right.
All right. Great. So we'll be getting back in touch with you. We'll follow up with James. There's so much more we're going to do with him. So look for more of James' work on total health. In the meantime, enjoy the rest of your holistic practitioner. We're at the Marriott Hotel and Spa here in Coronado. That's the beautiful San Diego backdrop here for us.
Absolutely, right?
Yeah. So be healthy and baby steps. Back to the studio.